Good afternoon to one and all present here. Anchana ma'am, am I audible?
Yes, ma'am, you're audible. You can go ahead.
Yes, thank you. Good afternoon, and I welcome you all for this session on awareness program relating to cervical cancer. Let us begin this session with a word of prayer. Let's bow our heads and place ourselves in the presence of the Lord. Dear God, we stand before you in humble prayer before we start with this program. We realize that without your blessing,
So good afternoon, everyone. So it gives me immense pleasure to introduce our speaker for the today's program, Dr. T. Ramani Devi, National Vice President of FOXY, India. She's here with us to address on cervical cancer. And a small intro about Madam is a managing director in Ramakrishna Medical Center and Janani Fertility Center in Trichurapalli, and she has over 30 years of experience in her field, and she has won 10 gold medals during her UG and PG. So I would like to highlight only few of the awards which is listed here. She won the Women of the Year award by Bardhasan University in 2013, Women Achiever Award by Citizens of Trichy 2015, and she has won the prestigious award of Dr. APJ Abdul Kalam Award in 2016, and she was also a recipient of Best Women Doctor Award by Tamil Nadu State Indian Medical Association in 2019, and Currently, she's the National Vice President of FOXY 2020, and she's also been a member of International Advisory Board member of Endometriosis Society of Bangladesh. Thank you, Doctor, for accepting our invite and joining us through this virtual platform, and in spite of your very busy schedule. Thank you, Doctor, and over to you. Doctor, I am just stopping my screen share. Am I audible?
yes, ma'am.
Yeah. Doctor, you can start.
Yeah. Hope I am now audible and visible. Hello.
Yes, Doctor, you're visible and
Okay.
also. Yeah.
So good afternoon, all of you, all the girls and all the faculties of WCC Chennai. So today I thought something you must know about cancers that are happening in the women. I bring you greetings from Rock City, that is Tiruchirappalli. And hope you know that February 4th has been declared as a World Cancer Day by WHO. Now, this month, we have so many cancers which are happening in among the women. And the most common cancer is the breast cancer. And second to the breast cancer is the cervical cancer. Cervical cancer means cancer occurring in the mouth of the uterus. So I think you will all be aware about the Pink October. That is the month of awareness about cancer of the breast. But January is supposed to be the cancer awareness month, especially for cervical cancer. And almost this month we have chosen, that is the month of March, that is the cancer screening month. So on behalf of the Federation of Obstetric and Gynec Society of India, for which I am currently the Vice President, we have been doing across pan-India cancer screening programs for all the women of reproductive age group. Pink ribbon is the color for breast cancer, but whereas this bluish green color is the awareness for cervical cancer. You see, it is found to be the 7th most common cancer in the world, and more than 600,000 women are diagnosed to have cancer cervix every year. This is according to WHO. See, this is the uterus. You see the fallopian tubes, ovary. This is the vagina, and this is the cervix. So the cancer occurring in the cervix is called as cancer of the cervix. Why do you get cancer? It is most probably because of mutations that cause cancer, and most often the cancers are acquired, with the exceptions to some of the cancers which may be inherited. This is according to American Cancer Society. So, American Institute for Cancer Research also says that almost 50% of the cancers can be prevented if you eat properly, avoid obesity and stay lean, move more, that is when you do more exercise, when you don't smoke, when you protect your skin from excessive sun heat, and then also once when you get vaccinated, you can all be prevented from cancers. Now the burning thing is, we are all getting vaccinated against the COVID infection. Like that, vaccination against cancer should be included in any immunization schedule. So this is something like the normal cells, which are attacked by the proto-oncogenes. Oncogenes means the genes that are going to cause cancer. And at the same time, we have the inherent tumor suppressor genes in the body, which are acting like a policeman, so that they preserve the normal cells. Whenever there is viral genes or the oncogenes, when they attack the normal cells, and that is being augmented by the mutated genes, when the tumor suppressor genes are all downregulated, you get the appearance of cancer. So now to prevent cancer, you must upregulate these tumor suppressor genes, downregulate the proto-genes, which can happen only with healthy lifestyle and safe environment. So, as I said, March is the Cancer Cervix Awareness Month. And let me dedicate this talk and time to our sisters who have succumbed to this dreaded disease. I also salute the great woman doctor, Dr. Shanta of Adayar Cancer Institute, who has died recently, and she has been awarded so many awards, Magsaysay Award, and her name has been recommended for Bharata Ratna. She has entirely dedicated her life towards the betterment of the women suffering from cancer. So She was the founder of Adayar Cancer Institute. The older version is cancer cannot be prevented but can only be identified earlier. But the newer version is we know now that cancer is preventable and 100% curable. So now coming to what are all the common cancers in the women. First is breast cancer. Next is cervical cancer, that is uterine mouth cancer. Third one is the colorectal, that is occurring in the large intestine or stomach or anything. Fourth commonest cause is the lung. Nowadays, recently we are getting more and more of colorectal and lung cancer because of our alteration in the environment, and lung cancers occur mostly due to pollution of the environment, and colorectal cancers, they do occur when our food habits are altered. So this was estimated list of cancers that are occurring from 1975 to 2000. Here it is 4,59,400 cancer cervix was found to be in 75, but whereas the incidence has come down during 1990 and again it has slightly increased. But when compared to all other cancers, for example, you see the lung cancer has increased dramatically, and the breast cancer has also increased, almost doubled up. But on the contrary, the incidence of cancer of the cervix has come down, or it is remaining static because of the initiation of screening for cancer cervix. And worldwide, it was Dr. Shankar Narayanan, who is a veteran oncology person who hails from Dindikal. He was the one who first formulated that screening of all the reproductive age group women can reduce the incidence of cancer cervix, and that has been accepted by the WHO. So this is the cervical portion, and you see the cervix that has been, you can see the cancer tissue in the mouth of the cervix. So the simple thing is you can always view the cervix by just putting in a speculum inside the female genitalia. If you put in a speculum, that means I can show you in the subsequent pictures. So now I said the incidence of cancer cervix is almost remaining parallel, and mortality means the death because of cancer cervix has been declining. That is all because of early screening. Then how to prevent cancer cervix? First thing is delay the age of marriage. That is because the earlier the incidence of sexual activity, that is going to aggravate the incidence of cancer of the cervix. Again, sexual hygiene, no smoking, barrier contraception, prevention of sexually transmitted diseases, routine screening, and human papilloma vaccination, they are all going to prevent cancer of the cervix. Cancer cervix peaks around 40 years of age, and it is most commonly seen in lower socioeconomic group where they have poor sexual hygiene or menstrual hygiene, and again they don't go for proper medical checkup and screening. And early marriage is also seen in the lower socioeconomic group where they get married even at the age of 16 or 17. And there are high chances of sexually transmitted diseases and multiple sexual partners. It is one of the most important causes for the cancer of the cervix. Again, I said smoking, alcohol. Then dietary deficiency of folic acid and vitamin, because these folic acid and vitamin C are all found to be, they are very good antioxidants which can fight against the cancer cells or the tumor cells. So these antioxidants are very, very essential for prevention of any form of malignancy. So that is why of late, after the occurrence of COVID, all of us are in the habit of taking higher levels of doses of vitamin C, which is a very good antioxidant, and we know that it can to extent prevent the virulence of the coronavirus. So similarly, cancer cervix is also caused by one type of virus called as human papilloma virus. So vitamin C can also fight against this virus. So now the question is, I've been telling screening is very important. That means if you start screening for the cancer of the cervix, 3 years after marriage, we have to start screening. And every 2 to 3 years, you can have what is called as a pap smear. See, this is a speculum where it is introduced into the vagina, and you can see the cervix. And the cervix that you can take with the help of the stick, you can take the smear. Then once when it is being stained, you can see this background cells, polymorph cells with the cervical shed cells from the cervix. So the screening methods are visualized. Take a pap smear. After that, if the pap smear shows some abnormal cells that are suggestive of pre-invasive cancer, then that patient has to be subjected for colposcopy. Colposcopy is nothing but I can show you. See, this is the putting the speculum, and you can see this very beautiful cervix. But you see, these are the white patches and the margins which are irregular. So these white patches are sites where it is likely to have infection. This sort of pap smear is nowadays done by all, even the paramedical workers in the primary health centers, in the government hospitals, in all the private hospitals. Again, for the confirmation whether the patient has got cancer or not, you have to go for a biopsy. Take a bit of tissue of the cervix, subject for biopsy, you can find out whether the patient has got cancer or not. See, for a woman to have cancer cervix, it takes roughly around 10 years. It is not that today the infection comes and tomorrow the cancer appears. It will go through series of infections like mild inflammatory infection, followed by mild dysplasia, moderate dysplasia, and severe dysplasia, and cancer in situ. Then only it will go to invasive cancer. So that means we have got the 10 golden years. If we are able to screen these women during this period, we can always prevent this cancer cervix from becoming an invasive one. And when you see at a earlier lesions, they can either be, they are completely curable. You can just do a surgical excision, or you can do cryocauterization using ice at nitrogen at a high, very low temperature, and you can form ice cubes, and that can completely destroy the cells that are abnormal. And another important thing is, in any women who is immunocompromised, that is the most important thing. In immunocompromised individuals, what happened is, you think about the picture what I showed earlier, the protective genes are suppressed. The policeman is suppressed because of the immune suppression, and the oncogenes, they take the upper hand. Such a situation happens in women who are affected by HIV infection, where they have immunosuppression, and hence they are also prone for cancer of the cervix. So this is the colposcopy. So then we need to know who are all the high risk patients. Any HIV AIDS patient is prone for infection. And another one is patients who are on chemotherapy or steroids, or when they have, that is, one patient has got one form of cancer and she is on chemotherapy, then her chances of getting the second cancer is quite high. And diethyl exposure, when the female who is getting cancer is being exposed to this particular drug during its presence in utero of the mother, then they are also at a high risk of developing. So cancer can happen in the cervix, in the vagina, uterus, and the ovaries. It can be prevented by screening. So what is meant by screening? Screening means it's a search for the disease. That is, in women who are without any symptoms, we screen them and we find them. So if a patient needs to have symptoms, usually they will present with advanced cancer stages. For example, the early cancer will not be symptomatic at all. Slowly, when the cancer advances, they will have vaginal discharge, pain, difficulty in passing urine, passing motion, and there will be foul smelling discharge from the vagina. So even if before this state comes, if you can have a proper screening, it can save thousands of lives. So that is why we advise every woman to have a pap smear at least once in their lifetime. 3 years as early as the woman has started sexual activity. So what is pap test? This is what I was telling you. Pap test means you are exposing the cervix with the speculum and putting an ice cream spoon like thing, and you take a swab at the level of the cervix, and then you put it in the fixative, and when you subject to the staining, then you can find out whether the cells are cancer cells are present or normal. So this is the normal cervical cells, but you see how the precancerous cells are appearing. The nucleus is very large, the cytoplasm is lower, but whereas the normal cells will have a small nucleus and a larger cytoplasm. So suppose pap smear is not that, just simple pelvic examination or testing for ovarian or uterine cancer differs from doing a pap test. Pap test does not detect the presence of sexually transmitted diseases. So how can you prevent the cervical cancer? I told you that if a person has to have a cancer today, 10 years before itself, the symptoms would have appeared. So by proper screening, you can pick up the precancerous lesion. So this is a beautiful spiked protein containing human papilloma virus, which is similar to somewhat like a COVID corona thing, but it will have spikes which are marked, and this papilloma virus does not have any spikes. So this genital HPV is a virus that is spread mainly by sexual activity, and any sexually active women, they are likely to harbor these viruses. But normally, these viruses are all washed away from the genital tract by the immunogenicity of the individual. And there are many HPV virus starting from 16, 18, so many viruses are there. But of that, 16 and 18 are said to be important for causing cancer. Again, men can also harbor HPV infection, and again they are also prone for the cancer of the genital tract. Male genital tract cancer can happen. Sexually active women, they have exposed to HPV virus by 50 years, but then not everybody gets infected because of the property of that immunogenicity or the capacity of the individual woman to fight against this viral oncogen. Again, I said it can be transmitted when a woman has got more than multiple sexual partners. They have a higher chance. An abnormal papinicular stain or pap test is often a sign of HPV infection. And again, more specifically, HPV DNA testing can find out the what is the whether it is a high risk HPV type or whether it is a low risk HPV type. So for typing, you can use this HPV DNA testing. But I said more than 80% of the women get HPV infected, but not everybody gets the cancer cervix. That is because 1/3 of the patient's HPV infection goes away, that clears off on its own. And sometimes it may not go away, but it may remain dormant, and later on it can become cancer. If I have HPV, does it mean that my partner has been unfaithful? No, HPV is not a sign of having multiple sexual partners, but you may have had HPV infection many years before and it shows up only now, according to the pap smear. So who are at a risk of developing cancer cervix? Women who do not have pap smear test. If you are not subjecting yourself to pap test, you are at a high chance. Then women who do not follow up with the testing and treatment of abnormal pap smear as told by the healthcare provider. Or when the woman has got persistent HPV infection, women who smoke, who don't have a proper meal pattern. Then how do I lower my risk of getting cervical cancer? Most important thing is do a pap smear. Limit the number of sexual partners. Choose a sexual partner who has got no or prior sex partners. That means you must be faithful to the partners. do not smoke, keep a healthy diet, have a good lifestyle, use condoms consistently and correctly during sexual activity because condoms can prevent the transmission of HPV infection. So if you do a pap test, what is the pap test will tell you? Pap test will give you whether it will be normal or whether it will be abnormal. In the abnormal test also, it can range from minor changes to moderate changes to severe changes, or probably the last one is cancerous. So abnormal pap tests are very, very common. We do get mild lesions, but they are only slight lesions and they can be treated at an earlier stage. And you need to repeat pap smear after 6 months so that you find out whether the lesion is progressing or not. If the disease is not progressing, you can follow up the patient. Otherwise, what you should do is you should go for proper management of this precancerous lesion. So again, you should start doing pap smear 3 years after marital life, not later than 21 years. And you have to have almost not, I wouldn't suggest you every year because it's going to add up to the cost and the burden to the medical fraternity. So preferably after once in 2 to 3 years, if you have 3 times or 5 times normal pap smear, then the risk of getting malignancy, cervical cancer is very low in that particular person. Okay, so around the age of, I said you can stop doing pap test if your 5 subsequent pap tests are negative or when you reach the age of 65 or 70. Because beyond that, the chances of getting malignancy are quite low. So these are all. So if I need a pap test, see, this is another question that has been asked. Suppose if our mother or elder in your family has got a hysterectomy done, that is removal of the uterus, then the next question asked is, on those people, do they need pap test? Yes, they need to have a pap test. So there are 2 varieties. You have a ordinary pap test where you take a scrap and put it in the fixative and do it with a eosin and hematoxylin stain. Another one is the liquid-based pap test, which is very accurate and it can type the HPV infection also. So the most important thing is go for a regular pap. You get an appointment. And then now the next thing is how to, I said there are some vaccines which can prevent the malignancy. One such vaccine is hepatitis B virus vaccine and human papilloma virus vaccine. Hepatitis B virus vaccine is the one what everybody we take for prevention of jaundice, hepatitis B. The most important cause for liver cancer is hepatitis and B virus, hepatitis E virus. So that can be prevented by taking HPV vaccine. Similarly, papilloma virus vaccine can prevent the cancer of the cervix. Then the next question asked is, at which age we must have these vaccines? Commonly, everybody knows HPV vaccines are given as soon as the baby is born and for the 6th month, 6 weeks later, and the sequence of HPV vaccines are given for the newborn within the first 1 year. And every 5 years, you can have a booster dose of HPV. But human papilloma virus vaccine, ideal period to give is around the age of 12 years to 14 years because it is only at that age there is maximum level of immunity that can be generated. So I advise young girls, all the adolescent girls should be vaccinated with both these vaccines. Suppose if you have not known about this vaccine or if your family doctor has not told you about this vaccine, then you can always have it before you get married. Even married women, if the pap test is negative or liquid-based cytology for HPV virus is negative, we can always have human papilloma virus vaccine even up to the age of 35 to 40 years. But again, you need to have 3 doses of vaccine to be given, 0 dose, repeat the dose vaccine around after 2 months, and the third vaccine has to be done after 6 months. So again, it is preventable, as we need a lot of time we can have for the progression of the disease, possibility of behavior modification, that is lifestyle modification, availability of screening, viral etiology and availability of these vaccines, all these things can prevent. Smoking. That is a predisposing factor along with alcohol for any type of cancer. Either an active smoking, or if a member of the family smokes, you are all exposed to passive smoking. That can also predispose to cancer. Again, sun exposure. Going in the hot sun is needed for our vitamin D production, but at the same time, it can lead to skin cancers. Diet is a very, very important factor in prevention of cancer. Most important thing is colorful fruits and vegetables are going to keep your life colorful. You should try to take a lot of vegetables, fruits, minimum of 5 servings per day. And in the food, you try to add garlic, ginger, curcumin, fenugreek, that is vendayam. See, all these things are becoming more popular during the COVID season because all are able to fight against the virus. Again, I said vitamin A, C, keratin. Carotenoids are nothing but colorful, colored pigments that are present in the carrot and other colored vegetables, folic acid and antioxidants. Mind is no animal fat. Be a vegetarian, because non-vegetarian stuffs, they are likely to increase the alter the gut microbiome and promote the colorectal cancers. Again, all our people, they are very fond of going to barbecue, grilling, pan frying, that is putting all the meat in a or a fish, everything straight into the heat, that is likely to cause all oxidants, free radicals can be released, and all those things are going to be carcinogenic. Again, cooking with the oil that is repeatedly used, frying, these all things which can promote carcinogenicity. But one good thing about the food is take lot of yogurt. Yogurt means our common this tire. Curd has got the natural capacity to suppress inflammation and then reduce, it can suppress cancer. Again, it has got a good beneficial effect upon the microflora in the gut, and it is similar to that is found in the breast milk of the mothers. So that means it is good. Taking alteration in the food is good. So cancer is preventable, and the preventable main thing is avoid tobacco, good food. Obesity is one important factor. All obese women have got a very high risk of developing breast cancer, uterine cancer, etc. Infections because of papillary virus infection, reduce physical activity, radiation, alcohol, and most important thing is occupational. See, even when we are exposed to asbestosis, and I would rightly say this currently, environmental pollution is one of the most important causes for carcinogenesis. So prevention of all these things will be very cost effective in long-term strategy for control or prevention of cancer. Thanks for the opportunity given. This is a beautiful sculpture which is seen in Sri Rangam temple, which has been, rather we should say it has been cleared and beautified currently. Thanks for the opportunity given. Anjana?
Yes, my name is Shweta Srikumar, and I would like to convey the vote of thanks for today. Am I audible?
Yes, quite audible.
Yes. So yes, cervical cancer, as it has been already mentioned multiple times during the talk, is the second most common type of cancer amongst Indian women. Therefore, the significance of this talk cannot be stressed enough. I can doubtlessly say that our students are fortunate to have gotten the opportunity to learn about this cancer from someone with such commendable expertise on the topic as Dr. T. Ramani Devi. Doctor, your talk was extremely educative, but lucid enough for girls to understand. You've taken pains to provide all kinds of information associated with the cancer and the testing strategies and the ways to prevent them and everything. Your talk was exhaustive, ma'am. As we all know, knowledge is power. I believe that this talk has empowered our beloved students to take charge of their bodies and keep themselves in the best health possible. Your explanation about the way women are screened for cervical cancer, I'm certain will be very helpful, considering how such tests can be physically very discomforting. Thank you for finding the time in your busy life to educate them about these issues of significance, ma'am. I'd like to also extend my gratitude to Dr. Lillian Jasper for being the pillar of support for any initiative in WCC. I have to mention Dr. Lynette, who has made this possible by giving the opportunity to organize this talk. I also take this opportunity to thank my dear colleagues for working in perfect coordination and cooperation to make this event successful in spite of the various challenges we are facing in the present times. It would be impossible for me to conclude my word of thanks without mentioning the students who've been a great audience during the past hour. I hope you've been enlightened by this talk. Last but not the least, I thank God for helping us conduct this event smoothly and successfully. Thank you.